In light of the COVID-19 situation, the Ministry of Public Health is to propose to the Operations Center of the CCSA the imposition of travel restrictions in and around Bangkok for at least 14 days as daily new COVID-19 infections surged to a new high. According to the Disease Control Department, the proposed travel restrictions are to be called self-bubble and seal, with the aim of limiting travel from home, to increase working from home, to negate the need for 70% of the normal travel by office workers. The self-bubble and seal or the semi-lockdown measure will cover Bangkok, Nonthaburi, Pathum Thani, Samut Sakhar, Nakhon Pathom, and Samut Prakan. The new measures, if approved, are an attempt to contain the rapid spread of the Delta coronavirus variant. Public Health Permanent Secretary Dr. Kietiphum Wongrachit, who chaired the Public Health Ministry's Emergency Operations Center or the EOC meeting this morning, said that the main reason for the proposed restrictions and other measures to be proposed is to reduce the number of daily new infections in Bangkok and its vicinities, and to ensure that the health system has the capacity to help those who need it the most. Dr. Kietiphum said that the EOC meeting acknowledged the latest report on new infections, especially the fact that most of them are concentrated in and around Bangkok, and the current pressure on hospitals and medics resulting from the rising trend in new infections. He said that the EOC will also propose that the CCSA's Operations Center increase the use of rapid antigen tests at hospitals, which can produce results in 20 minutes instead of the RT-PCR tests, which can take up to 3 to 5 hours or longer. However, in case of positive results from rapid antigen tests, a test by the RT-PCR method will then be administered. The EOC will also propose an adjustment to guidelines regarding the home isolation to make the measure much easier and conducive to the current situation. Under the plan, those with mild symptoms will be subject to home or community isolation and can live with the other family members, but are required to observe strict social distancing, wear face masks at all times, and wash their hands regularly. Accelerating vaccinations in high-risk areas among those who are over 60 and for those afflicted with any of the 7 underlying diseases to achieve at least 80% inoculation within 1 to 2 weeks will also be discussed this afternoon. Other measures to be proposed include restrictions on cross-border travel and venues and activities which are considered to pose a high risk, with the exception of markets and supermarkets. Dr. Kietiphum said that the ministry wants everyone in the high-risk zones to stay at home to stop the disease for the nation, unless it is necessary to buy food, see doctors, or to get vaccinated, adding that the restrictions being proposed are similar to those imposed during April last year. Meanwhile, General Nathapol Nakpanit, the director of the CCSA's Operations Center, said this morning that he's waiting for the proposed measures from the Ministry of Public Health, but will take into account proposals from the other relevant agencies as well. He said the main concern is the impact of the proposed measures on people in general. Any decision by the CCSA's Operations Center will be submitted to the CCSA, chaired by the Prime Minister, for conclusion. It is reported that the CCSA has decided to move its meeting from Monday to tomorrow due to the urgency of the situation.